of things that you can do to have a successful placement. So I've come up with a few ideas after talking to some of my friends, which we all think would be ways to have a successful placement. So firstly, something that's extremely important is going to be being punctual and having a good attendance. It's really important to get there on time, so you're there for the handovers in the morning, so then you get an update from the night shift of what's been going on, and then you're prepared for your day. Also, alongside being punctual and having good attendance, it's really important that you present yourself well, so you have a clean uniform at every single shift, got your hair tied back, really important to have nothing below your elbows as well. Secondly, to be successful, you're going to have to take it in your own hands to do some learning. So when you're on the med rounds with the nurse, take it on yourself to ask questions about the side effects and what the drug does. So like how amlodipine is a calcium channel blocker, so what's a calcium channel blocker? What does amlodipine do? How ramipril is an ACE inhibitor. What are the side effects of an ACE inhibitor? Try and find out more about the analgesic ladder. What would a patient after surgery need for pain relief compared to a patient who is 3 days post-surgery? So is that different? What would you need to give them? Also on your medication rounds, there's normally a little leaflet in the boxes of the medication. So I always like to take that leaflet home and maybe read it on the way home, or read it once I get home, and then it just gives you a bit more of an understanding of the side effects of the drug or what it's used for. So definitely try and get those leaflets, just ask the nurse for them. Another thing you can do is try and arrange spokes. So a spoke is when you spend some time in a different department, and that can be anything from a few hours to maybe a week or 2 weeks. So these spokes can be in a range of areas. They can be with other nurses in different departments, so maybe you'd be on a surgical ward, so then you might go to a different surgery ward just to see what it's like. Or maybe you could spend it with completely different practitioners, such as your doctors, your occupational therapists, your physiotherapists, dietitians. So when you're in meetings, you understand the role of the multidisciplinary team more thoroughly. So I've done spokes in various areas. So when I was on a surgical ward, I spent time in theatre, so I got to see some really interesting operations that made me understand what I was seeing on the ward more. I've been in a GP surgery and then been on a spoke to a community placement, so I went there for 2 weeks, which was really interesting because I learned a lot more about leg dressings and about wound care, which I thought was really useful for me. And also I've spent time with various practitioners, like I said, such as your occupational therapists and physiotherapists, just to understand the recovery process of your patient as well. Another really important thing you should be doing is trying to get involved with clinical skills. So if you're working with a nurse and she needs to insert an NG tube, or if you need to catheterize a patient, try and observe that, and if you feel comfortable with it, volunteer yourself to have a go, because obviously we need to tick off all these competencies, and it's really important to say insert an NG tube, do catheterization male and female, just give everything a go and put yourself forward. Don't wait for someone to ask, you should be asking. Another tip would be to reflect on your work. So after a long day, if you've experienced something that has really pulled on you or really affected you, you should reflect on it. That will just help you pick at the scenario and see what you could have done better or what you did do good, and you can just take that forward with your practice. So yeah, reflect. Another thing is just ask questions about absolutely everything. If you don't know what something is, ask a question. If you want to do something, ask the question. Just keep asking, because at the end of the day, that's how you're going to learn. If you're a third year, maybe volunteer to have some of your own patients. Then you get an idea of how to organise, how to manage a set of patients. Because having a group of patients is different to just having one. So you're going to have to manage your time better, and you're going to get a bit more prepared for when you're going to be a nurse in, say, a year's time or 6 months' time. So guys, I hope that's been useful, and I hope you can take this forward in your practice. If you'd like to like, comment and subscribe, I'd really appreciate it. I'm just really enjoying making these videos at the moment, just trying to advise people of things I've learned as being a student nurse. Stay home. Stay safe.